Well, Sir Michael, thank you very much for talking to us today in the Department of Twin Research, and we're always very interested to talk to some of our interesting twins, and obviously as a past president of the International Diabetes Federation, maybe you can tell us what motivated you to advocacy for diabetes and diabetes research.
Well, prior to becoming president of the International Diabetes Federation, I was the first non-medical chairman of Diabetes UK, which is the organisation for people with diabetes and those who care for them in the United Kingdom. And that came following my advocacy for diabetes care when I was a member of Parliament. The people with diabetes had long pressed for access to blood glucose monitoring and to disposable syringes for insulin, and it was a long battle, but I just happened to be there when the final decision was made to make these available, and was then invited to join the board of Diabetes UK and ultimately became its chair. And during that time we actually persuaded the government to introduce the National Service Framework for diabetes, and that made a huge difference to care in the United Kingdom. So when I later moved on to the International Diabetes Federation, we've worked very hard with governments all around the world to try and bring in service levels for people with diabetes, and also to push the prevention agenda, because 400+ million people with diabetes today, unless there are effective prevention measures, these numbers are just going to go on rising. Mm-hmm. It's a disease which can have fatal complications, but it's also ruinously expensive for countries, killing or incapacitating people of working age.
Mm-hmm. And what do you think that the major challenge still is in diabetes?
Unquestionably, it's introducing effective prevention measures, and we're already starting to see things like tax on sugary drinks, something that I would certainly have welcomed coming a lot sooner than this. Mm-hmm. The food that people eat has a significant effect upon their health, and as the twin study is showing. So there's a lot to be done to stop people developing diabetes, and many cases of type 2 diabetes can be prevented by lifestyle modification. But in addition to that, when someone has diabetes, it's important that they're identified as quickly as possible and treated as well as possible. And if they are treated well, then they can have the expectation of a long, happy, healthy and productive life. If not, then they become susceptible to potentially fatal complications.
Yes. And obviously here in the Department of Twin Research we are studying the genetics and environmental factors, including the diet, on many common complex age-related traits. Mm. What motivated you to join our twin cohort?
Well, I'm here with my twin, and neither of us is really terribly sure which took the initiative to show an interest in it. But I certainly received an email some time back inviting me to participate, to fill up questionnaires and to provide information, which I was happy to do, because in my work in diabetes I've seen the importance, the value of research findings in so many different ways. And with twins it was interesting because in many ways the health of my sister and myself has diverged over the years. She has developed multiple sclerosis, I have not, but there are differences, and therefore anything that I think both of us feel quite strongly about this, anything that we can do to deepen the knowledge about health within twins that will have the beneficial effect of either finding cures for things or helping to recommend new therapies, well, it's worth doing. And I know that in medicine there has to be an evidence base for conclusions and for changes. So I hope in some terribly small way we're contributing to that.
Absolutely, and indeed our twins have already contributed and are contributing to really groundbreaking science. Having had your twin visit today with us, how did you find it? What was your experience of the twin visit?
A really enjoyable experience. I was sent a lot of information beforehand about what the tests would be and so on, but I think you really have to come and go through it to appreciate the value of it. And there is something genuinely very encouraging, heartening to be able to have your your cardiovascular system looked at, and to be told that you're actually in good nick, especially at my age. So it was a very comprehensive range of tests, and in many ways I know a little bit more than I did when I came here, and I certainly have got a reassurance that in key areas of health I'm still fairly fit and well for someone of my age, but I know that I'm overweight, and I know I need to do something about that, and I knew that before I came here, and perhaps now I've got a little bit more encouragement to lose a little bit of weight now.
Right, well, Sir Michael, thank you for your altruism and for your contributions to diabetes and science, and your contribution today to the Department of Twin Research. Thank you.
Well, may I thank you, because I was struck by the enthusiasm and professionalism of the staff who were involved in the Twin Research Programme. It was a joy to work with them, and I'm grateful that you are running this programme, and I genuinely do hope that some very worthwhile conclusions will come from it, which will help to keep us as healthy as possible for as long as possible.
Thank you.